Welcome to What the Health? The podcast where anything health is fair game. There's a lot of garbage advice and misinformation out there that can leave you feeling stumped and stuck. Together, let's sift through the sea of BS and find the best ways to get healthy and stay healthy. Join the team as we tackle the trends and bust the myths about health and wellness. Here are your hosts, Dr. Dan Turo, Angela Turo, and Dr. Riley Brown.
Welcome back, everyone. Today, here back with Dr. Riley, which, again, I feel like you haven't been on for a couple episodes.
I know, I was thinking about that the other day.
But it's good. So, you know that you get the two of us together, we're always going to talk chiropractic, right? So you had a great idea to discuss are you too old, or when is it too late to start chiropractic care, or are you too old to start chiropractic care?
Yeah.
And why did that idea hit you?
I just feel like some of the recent patients we've had and successes, it's like, you know, they come in, we look at their x-rays, and they're kind of not the prettiest x-rays, you know, in terms of like degeneration and stuff, but I think we've still had great results. So when you hear about, you know, we emphasize get your kids in, get them checked, so that way we don't have any issues down the line. Then we still, you know, not everybody's getting checked. And so seeing these people, you know, above 60, 70, even in their 80s come in and we get them some sort of relief and quality of life back, it's kind of like, in my opinion, you're probably never too old for chiropractic care.
I would agree with that. So let's say you touched on a couple of things there. So when you say degeneration, okay, because we use that term a lot in the office, what exactly do we mean when we say degeneration if we're looking at someone's spine?
Yeah, so, you know, you have arthritis and stuff like that, but the degeneration, we're typically looking, you know, not to get too anatomical, but the facet joints, so the joints that, you know, connect the bones and allow them to move, the discs, just kind of where the body has a lot of, you know, tension and stuff like that, the body will kind of lay down some calcium or lose the disc height, you know, in the spine, and that's kind of where we see the most degeneration.
So a lot of people ask, well, you know, is this just related to old age, right? Because, you know, that's the number one comment we get, like, well, yeah, Dr. Dan, I'm in my 60s or I'm 70, you know, or I'm 80 years old. Like, you know, I expect to see arthritis or degeneration in my spine. So how do you answer that for those people who are looking for answers, or just think that it's hopeless?
Yeah. Yes and no. I mean, you wear and tear on anything, you're going to get some sort of, you know, degeneration just from gravity. You know, you work from gravity all the time. Discs are soft tissue. So, I mean, just look at skin. Like, you can take care of skin as much as you want. It's still going to, you know,
it's going to look different at 80 than it does at 20.
Yeah, and we've had patients that come in their late 20s or early 30s and have degeneration showing. And it's not from just age. They could have had a real bad car accident or, you know, crazy sports injuries or repetitive injuries that just led to that.
Well, I think I make sure you know, talking to patients when they're, you know, asking questions about their x-ray to help them understand that, yeah, you may have some degeneration here, and, you know, this problem may have been developing for 20, 30, you know, 40 plus years. But at the end of the day, we're only seeing degeneration maybe across 2 or 3 joints. It's like, but are those joints the same age as the rest of the joints?
Yeah.
And the simple answer is yes, they are. So it's like, well, why are those joints if it's just age related, all of that should look pretty similar, and it doesn't. So yes, age more from a process of time led to the breakdown of those joints, but there was still, you know, mitigating, you know, traumas, whether it's, you know, sustained trauma over time, sustained stress over time, or one rapid big trauma, you know, in, like you said, sports injuries or car accidents or something like that. So I think helping to understand the difference, you know, between those is important, you know, when we're looking at, you know, people's x-rays. So what do people, if they're, you know, 60, 70, 80 years old, and, you know, we have a couple patients in their, you know, late 80s, 90s, what do they tend to be looking for? You know, so if you have a parent or grandparent that's headed that direction, what are they looking for? What are their goals? Because obviously the goals at 80 are different than if you're in your 30s, you know, with your health and well-being. So what symptoms are they coming in with? What have you seen, you know, us help help them with.
Yeah, quality of life. I think that's the biggest thing. Like obviously they want to get out of pain and stuff, but if they can, if they're shuffling in the door, I'm very, very bad at their balance. I think that's the biggest one that I've been seeing recently. It's, they're scared to go out and do anything because what if they fall, or, they're so dependent on others that they don't want to be a burden to their family. And then, just the quality of life, I think, is the biggest thing. We've had, a recent patient, she came in after, I think she had surgery, and she was rehabbing the ankle and just couldn't go out and hang out with her friends and do, stuff that she wanted to do. And I think she did 12 visits. And that last visit, she walked by the room I was working in. I had to double take. It was night and day difference of, the walking that she was able to do. So I think that's the biggest.
When she came in with a walker, and she was not using it, within, 2.5 months of, seeing us on a weekly basis. She was, walking without it and walking very confidently, to know that she, didn't feel like the need, like you said, falling back on that walker, which again, if you need assistance, by all means, it's much better to have that and not need it than to need it and not have it, because falls, as we've talked about on other episodes, falls are the number one risk for, for mortality really above 65 years old, because it's not that the fall itself is going to take them out, but the fall leads to, a break, a hospitalization, and then, very poor health over time. Just a personal story. I remember very vividly, my grandfather, he took a pretty severe fall. I think he was in I want to say it was 5 years before he passed. So he passed right before he turned 80. This was my dad's dad. But I remember we were visiting at my uncle's house. And so it was through the garage. That's where most people entered. They would walk through the garage. And then there was 4 or 5 wooden steps up to, the back door area to walk into the house. Well, he walked up and he was having help, but even with the help, he was up about 3 steps, and then he just kind of swayed a little bit. He lost his balance, and then he just went backwards and smacked his head hard on the concrete floor. And we actually thought we were going to lose him at that point. Now, he did recover, but he was never the same after that fall. And again, I remember that fall and that event very vividly. And he was never the same after that. Yeah. And so, when we're talking about seniors and, and their health and well-being, you're right, that functionality is so important, but, you're one bad step, one bad slip away if you're not taking care of yourself. Right. Yeah. But we see such a difference. Like you said, that one woman who's in her 70s came in with a walker, and then she was, hopping out of here. With that other gentleman, right, who started recently in his late 80s. Yeah. And what was he dealing with?
Classic foot drop.
Yeah.
He'd take a step and he just couldn't keep his toes up. It just kind of flopped straight down, and just, thinking about trying to walk with not having control of lifting your foot, especially at that age, and knowing the, timeline of falls and how risky it is.
And he was the kind of guy who loved to be out in his garden, right? Yeah. He loved to be outside working. And so, even at 87, that shouldn't be, you would hope that that's not a hindrance. Yeah. But if he didn't recover that, that's a quality of life, like you mentioned, that might not ever come back if you don't get it addressed.
Yeah. Yeah. And he walked in the door and you wouldn't know he was close to 90. He was very, very well taken care of. And so I think that helped, because he got results very quickly at his age. And so I don't even think he finished. He was like, I'm good. He was far away. So he was like, I feel great. If I need to come back, I will.
Yeah, it was less than, I think it was 7 visits. Yeah. 7 visits, on a weekly basis. And he was probably good at 6, but, we just did 1 or 2 visits after. But he recovered. And again, now, did he have degeneration and arthritis in his spine? Yes, significantly. Yeah. But, it wasn't to the point of fusing. So that's a lot of times when we talk about arthritis, if the bone starts to lay down so severely where it actually starts to fuse segments together, that's how a problem has been there for a long time, usually 50 plus years. But once it fuses, you can't break that. It's done. It's fused. But he had some pretty severe arthritis, not to the point of fusion, but if there's a little bit of ability to gain motion in there, you've got hope, right? Because that motion if you keep it moving, that's what keeps the spine lubricated and keeps the joints going. And, motion of the joints is life to that nervous system. So, yeah, I was really shocked with how quickly he recovered. Again, we expect it, right? We expect people to get better because if the spine's not moving and we help it move better, like you're going to see something improve. But I think, sometimes people do, they shock us. And you brought up a really good point in terms of what condition is someone coming in with. Like he was in shape.
Oh yeah.
He took care of himself, ate healthy, obviously very, very active, probably outside, moving around, 5+ hours a day in the, during the summertime. But you've got a lot of people that are on the flip side of that, right? That they're, their motion is, hey, I got to get up and go to the bathroom, or, they go from their bed, come out, eat something, go to their chair, they sit, they read, they watch TV. And again, they just get into this vicious cycle where, that lack of mobility just creeps up on them. And so someone like that who's very, very weak, has very little muscle tone, now, your recovery, we're not as hopeful. We still expect change, but there's more that you need to do to recover that.
The external factors, what we do in the office, we make good changes here, but then it's like, what do you do to you don't just show up to a sporting event without practicing. You're gonna play terrible. So you show up to the chiropractic office, you get your adjustment. All right, now we got things set in motion, got some things restored. Now you need to go out and use it and make sure it's just rehabilitated. And I think that's where we're getting even better results with Angela too, because there's some patients that are just kind of almost lagging behind a little bit. We send them once or twice to Angela, and they come in and we're like, wow, who are you? Like, you're a whole different person.
Night and day difference. And so Angela, who works as a part of our team, she does a lot of the functional training. So again, she's helping people rebuild that neuromuscular, balance, right? That, again, a lot of people think training and they're just thinking muscles, but everything for us is neuromuscular, neurobiomechanical. It's all, nervous system is your foundation. That's what controls and coordinates everything else in your system. Your hormones, your digestion, your heartbeat, like everything's coordinated, and that muscle coordination is so important from a strength and balance perspective. And so, we get the spine moving, and then now she helps to re-educate and retrain the muscles, or just educate. You can't re-educate something you never learned.
That's true.
How often do we see people that didn't ever learn the proper way to use or move their muscles?
I think the biggest thing is like abdominal bracing. Everybody, when you think about
using, you say that, of course, I'm like, all right, am I bracing myself?
Use your core. Everybody thinks about like hunkering down, Valsalva, like what weightlifter type of contraction, and really you got to just. She teaches it great. You brace the core, but you still got to be able to breathe while engaging it. And there's so many people that just don't understand that. I didn't know it until I got into undergrad. So it's like I played sports my entire childhood, and I never knew, maybe I was doing it unknowingly, but that's so important for stability and just the body's awareness of its space.
I just had a really good conversation with one of our referral partners, Dr. Chris. But talking, again, you got sports, and you start sports off at a young age, and again, you got soccer and gymnastics and flag football and stuff like that. But a lot of times these kids, you just have these parents that are coaching volunteers, but they're not formally educated in any kind of movement. And we did our whole undergrad. You did too, didn't you? Do your undergrad in exercise? So it's like we have our whole undergrad in movement education, and then you add the chiropractic on top of that. So it's like understanding masterfully how the body is put together and how one area affects the other. It's so important. And unfortunately, prehab versus rehab, right? So many times the rehabilitation comes because you didn't have the proper strength and coordination to do a movement. So it failed, which is what led to the injury in the first place. So if we're doing a better job of prehabbing, again, I know there's some, there's some discussion in sports camps around, not just the sport itself, but truly just, teaching healthy movement patterns, healthy lifting technique, and, stuff like that. And so, if your kid, is ever showing, so we just talked about the old side, but we're going back we always go back to kids, it seems like. But, if your kid is, showing any interest in sports or activity, it's like, please, please, please make sure that, they get into some sort of camp or training or work with a professional that understands how to move that body.
Yeah. I think you said the prehab and stuff, and I think about, once again, a couple of the elderly patients that we've had come in with knee replacements or, right before, and they're getting adjusted and feeling pretty good. And they're doing a lot of the stuff, that the doctors want them to do before that surgery. And then they come in, 6 weeks later and I'm like, did you have the surgery? And they're like, oh yeah, here's the scar. I'm moving great.
Yeah.
So it's like, they keep up on top of it, and, they're seeing great results at that. And that kind of reminded me of the other person I wanted to talk to about how he had a knee replacement.
Yeah.
And I don't know if it was during PT or after, it was sometime after the surgery, his sciatica really flared up on the opposite side. And once again, it was probably a month or two of correction for him, and he was good to go.
Night and day difference. Yeah. And so, we always go back to the fact that, when's the best time to start? The best time to plant a tree is 20 years ago. The next best time is today. So, if you're in your 60s, 70s, or 80s, and you've never been to a chiropractor, or you've only used chiropractic sporadically or, conditionally based, right? Like you had an acre of pain, you go in for a couple visits, all right, you feel better, you're back out the door. But if you've never truly used, chiropractic, for, a consistency, wellness, strength, foundational program as part of your, entire health and well-being, I really think you're missing out. I'll never forget that there was a gentleman who was giving a health talk, and he used the example of, if you buy a treadmill, you can buy a treadmill and you can hang clothes on it, right? Like it's a, it's doable, but if you hang clothes on a treadmill, that's a really expensive closet.
Oh yeah.
Versus actually, using using it for what it's meant for, right? So again, I'm not discrediting if someone comes in and it's a handful of visits and they're feeling better and they're happy with that.
Yeah.
Not upset about that at all. But again, you're missing out on the long term, vision of what chiropractic can be more under a consistency basis. And that consistency basis doesn't mean, you come in, once a week and get adjusted once a week. It's like that consistency basis, could mean that, hey, you're doing really good and, you're coming in once every 2, 3, 4 weeks. And maybe you're coming in, every other week, and we're only having to adjust you, once out of, once a month. And so, and each adjustment tends to be a little bit different too when you're consistent with your care, because, you have stress that's shifting around the body and changing. And so you're constantly adapting. If you're coming in and you're needing the exact same adjustments all the time, then again, you're stuck in that pattern, right? You're stuck in that rat race that, that's part of the whole idea of consistency. We're trying to break that neurological pattern that you're stuck in. So that's a lot of information.
No, it's true. There's been a lot of people that have kind of showed back up on the schedule. Like, oh, hey, we haven't seen you for a while. And they're like, yeah, like I just, I haven't been doing too hot, feeling, off. And so we adjust them, and I'm like, all right, what do you want to do? And they're like, I need to come in. It's, I'm feeling the effects of my age. And so, they check in, and, they still come in with some aches and pains, but, you watch them walk in the door. They're a completely different person.
Yeah. Versus, spreading out, your care. And again, it's like, ideally everyone in the world, could make it a month without getting adjusted. But we know that gravity never takes a break, especially when you're standing up or if you're sitting down. Because everything is, crunching down on you. So gravity is always working against you, pulling you down. You've got past traumas, sports injuries, slips and falls when you're learning how to walk, learning how to crawl, siblings putting you in a headlock, like, doing stupid things. You're a boy growing up and, doing silly things in, rural suburbia Ohio, right?
Indoor football,
we used to try and kill each other in backyard football, right?
Gosh,
I broke admittedly, I broke a kid's collarbone, not on purpose, but again, it's just, I hit him in a certain way and his chest bounced out, it busted his collarbone. And I actually got out of class for a while because we were in the same last period class. And so I volunteered to carry his backpack to his locker room. So we would always get out of class. It was like Spanish, I think. So we would always get out of class like 10 minutes early because he shouldn't be walking around the school, with his backpack on. He doesn't want to get bumped. Well, it was like we milked that. I mean, he was out of his sling in probably 6 weeks, but we milked that for probably half the school year. Getting out of class early. Finally, I think the teacher just asked one day, like, do you really need to leave? Still leave early? He was out of his sling, back to full use of his arm. But oh my gosh, I'll never forget that. His name was Jonathan. But yeah, I mean, we have those traumas on our, on our spine, and just throughout life, and being able to, work our way through them. The quicker you can get to the injury and work your way through it, then your body doesn't get stuck in that pattern. But like if you're injured and you don't completely, because you never learned the right mechanisms ahead of time, and now are trying, and you don't fully recover that injury, then again, your body starts to adapt to that injury. And that's where, you could have a low back injury that leads to, a shoulder pain. You could have, a mid-back, injury, subluxation that's leading to, headaches, neck pain. So, it's all interconnected there. And, at the end of the day, even if you're, 60, 70, 80, it's not too late, just the goals might be different. So it's just a matter of having that conversation and, just what do you want, right? What do you want out of life? That's what we're trying to do,
Yeah. Even if you're, 40 and 50 and you have an injury, like, please come in, because, I'm a little bit selfish and I don't want to work harder either. So, if you come in at 50 with an injury, it's better than coming in at 70 and be like, hey, I had a real bad car accident at 50. So it just makes both of our lives easier. Right.
Absolutely. Absolutely. So, we all know those times when we've, we definitely have, hurt ourselves or others, we're in an injury, in a traumatic state. And the faster we can take care of those and the faster we can get to a level of care. And the other thing that we didn't even talk about, but like if you are going through consistent chiropractic care and then you do unfortunately have an injury, I mean, we see the recovery is so much faster. Because, and it's not that it's faster, like you're recovering appropriately, right? Yeah. So, unfortunately what we see a lot of times is, those ankle, knee, hip injuries, they're the ones that are nagging and take 6-9+ months to like fully recover, or they don't ever fully recover and now they've become a chronic issue. Whereas the people who are under regular care and, okay, I tweaked myself, I'm stepping off a curb funny or stepping off my step in my house funny. And it's like, now they come in, they get adjusted and they're, within a visit or two, they're right back on track. Yeah. Because we're not having to rehash everything. We're staying on top of, of that as part of your, health and well-being. Yeah. So you too old for chiropractic?
No, never.
Never. We always say, if you got a spine and you're still breathing, chances are you can benefit from chiropractic care. So,
we've seen
it. So if you got any questions about our process or, whether or not a specific condition that you're dealing with could benefit through chiropractic care, we'll always tell people just reach out and ask. The discussion doesn't hurt to have a discussion, but yeah, if you're just curious, want to book an appointment, check that out. Or if you're somewhere else, not near us in the greater Pittsburgh region, reach out. We've got a lot of great colleagues all over the country, and great resources that we can, help find you, right fit to get you healthy and keep you healthy for the rest of your wonderful life. So that being said, we'll see everyone at the next one.
Yep. Thanks for listening.
You've been listening to another episode of What the Health? The podcast where anything health is fair game with your hosts, Dr. Dan, Angela, and Dr. Riley. Brought to you by Chiro Family Chiropractic. If you'd like to learn more about some of the resources mentioned on this show, or you have questions about something that was discussed, please reach out through our website at www.chirofamilychiropractic.com. Remember to like and subscribe to What the Health Podcast to catch all the latest episodes and replay your favorites. Thank you for listening, and remember, we're always here to help when you find yourself saying, "What the hell?"